All right. I think we've given enough time for the last minute stragglers to arrive. It's a little bit after 1 o'clock here on the East Coast of the U.S. And I am super pumped to introduce you guys today to our Healthcare Meets Tech webinar, everything AI within the healthcare industry. So this webinar is presented by Upskill Academy and our friends and partners over at AI Certs. Upskill Academy is a provider of training, and one of our favorite vendors that we work with is AI Certs, who's presenting this webinar today. So just to get going here, because I know you guys aren't here to see me, you're here to learn all about healthcare and the AI, and excuse me, AI in the healthcare industry. Got that backwards. See, that's why you're not here to see me. So we'll go a little bit about who we are here at Upskill Academy. You'll notice our logo incorporates the My Computer Career Business logo. So what we are is an extension of our friends and partners at My Computer Career. So what we do is we take the traditional method of students in classrooms learning about new technologies and getting certified and brought up to speed. And we kind
What?
of, oh, I think we get a little bit of feedback from somebody there.
Mm-hmm.
Just remember all attendees and panelists on mute here. But up at Upskill Academy here, we just take a continuation of the education that we provide, the stellar education at Upskill or at My Computer Career, and apply it to the world of IT. So every company has different needs, every business has different needs, and we are here to help alleviate some of the pain points in the IT industry today. We hire expert instructors. We have unlimited potential with our membership discounts, which I'll go over here in a second, and our unlimited offerings. We're continuously developing new bundles and new packages for you guys. We know flexibility is key. We offer live online classes as well as self-paced content. And of course, as I mentioned before, every business is different. Whether you're training a team of five or a team of 500 or a team of 5,000, Upskill Academy can help you based on your personal needs. We're flexible and customizable. A little bit about what we offer in terms of the traditional individual courses. We have a robust cybersecurity portfolio brought to you by vendors like CompTIA, vendors like Certified Ethical Hackers, a networking portfolio that goes through A plus IT Essentials, Cisco CCNA courses. We just launched a very robust Microsoft portfolio that we're continuously adding to every day. You can see a couple of examples of security courses, some Azure courses, and like I said, more being added every day. But of course, we also have courses from our friends here at AI Certs. AI Search does a wonderful job of doing role-based training. So whether it's you're just getting your feet wet into the world of AI, or utilizing AI for a specific business case, our friends here at AI Certs have the course for you. You can see just a few examples of some of the training options they have. And I will provide some links and QR codes that you can check out all of their offerings here at the end of the webinar, plus in our follow-up email. So I told you I'd take a little bit of time here to talk about our membership advantages. We do have 4 levels of memberships. Basically, if you're looking to save a little bit of money on your training, which in today's economy, I don't blame you. We have upskill memberships for you guys. We do have a free trial if you want to kind of see what it's all about. It's just a 7-day free trial that is a sneak peek at some of the content and benefits that we offer our members. Our pro level, you get access quarterly to our comprehensive learning profile and comprehensive library there, plus 15% off of all of your live instructor-led training. Premier levels, we actually do provide that 15% discount plus all of the content that I mentioned before, but your first course is 25% off. And then we have an enterprise level that was designed to be more than just a one-off, training membership discount program. We're actually going into different teams and offering different prices points based on the size of your team. So, again, a little QR code there, plus you'll get all of these links and QR codes and slides at the end of this webinar as well. Something else that I think really truly sets Upskill Academy apart from our competitors here, unlimited training. It's just what the name says. We have a unlimited cybersecurity option that for one flat annual fee, that's about the price of a course. You get access to over 25, it says here 28 And as we continue to add courses that will breach the 30 mark, cybersecurity courses, numerous labs, modules, digital resources, all at your fingertips for one annual rate. No other provider will do that for you. But really, what we are here to talk about is healthcare and technology. So I had the absolute pleasure of meeting our instructor, Miss Tiffany Price, earlier and learning a little bit more about her. You guys are in for a treat today. So today's webinar is led by, as I mentioned, Miss Tiffany Price. She is a recognized leader in artificial intelligence strategy and adoption with nearly a decade of experience in AI, long before it became the buzzword that it is today, of course. Tiffany has guided executives, HR leaders, and organizations on how to embrace AI through a people-first adoption strategy. She serves on the board of Chicago AI Days, authored an influential book called Leaders and AI, Top of the Mountain Leadership, and is frequently featured on podcasts discussing the future of AI in the workplace. Her work spans from machine learning and predictive analytics to practical business use cases, all centered around helping organizations unlock the strategic value of AI by reskilling teams, driving change management, and enabling leadership to communicate effectively through disruption. Tiffany continues to champion AI augmentation as a way to develop faster, smarter, and more cost-effective results while keeping people at the center of the transformation. So without further ado, I introduce you to Miss Tiffany Prince.
Hello and welcome. Thank you all for joining here today. We're going to give us just a second while we swap out presentations.
And it's all you, Tiffany. I have stopped sharing my presentation.
Okie dokie. And if you do want to ask questions, I will ask my co-panelists to kind of keep an eye on the chat for me just in case. But I have a couple things here to cover today. You might have some questions, so feel free to pop those in and we can cover that either in the flow or at the end, whatever makes sense.
And Tiffany, before you get going, I should just mention real quick as a housekeeping note, if you do want to utilize our chat functionality, you can either click the little bubble chat there, and if that's not working for some reason, I've had some people having some issues, please utilize the little question mark inside of the box there that's labeled Q&A. We can definitely get you taken care of from a chat functionality perspective that way.
Perfect. Thanks for that clarification, Lee. Appreciate you. Now let's go ahead and jump in. So Lee did a nice job introducing me, but let me give you a little bit more about my why and why you should be maybe paying attention to what I have to say. I have really been thinking about trying to learn about and embed myself in AI ecosystems for about 8 years now. I did sit on the Chicago AI Days board where we brought in quarterly speakers, mostly software engineers and data analysts that were creating platforms, algorithms, predictive analytics, imaging software, all kinds of things. So I got exposed to lots of different viewpoints, methodologies, and ways of kind of approaching different problems. So from there, I actually wrote a book because I really did see the future of work, that it's going to change. And I wanted to think about how AI is going to impact the future of work and how do leaders and teams need to get ready for that. Obviously, it's about some of the technology, but there's a lot of different aspects that kind of help us with this digital transformation. And I think, by upskilling yourself is a great way to kickstart your journey in AI and getting to know that better. So we're going to really focus and double click down on healthcare here today. I do have a lot of experience working with biotech, pharma, healthcare. I did start in the biotech area in manufacturing. So I know some of the constraints, regulatory, FDA, all different world regulations. So thinking about it from that perspective, it can be a little bit daunting and challenging. So hopefully today I'll open you up a little bit to think about things in a little bit different way. So on my agenda here today, I would like to kind of cover, why now? Why should you be thinking about getting yourself upskilled or really thinking about how AI is going to impact your future and how your organization might respond to that? So let me talk to you about a little bit of those pressures. What does it look like in the AI healthcare ecosystem right now? And why does it matter now? And then a little bit about some of the opportunities and challenges, because there's always a yin and a yang when we're, going forward and trying new things. And then the nice thing is we definitely have some additional guardrails and securities from regulatory agencies and different entities out there that can help us kind of build our AI strategy as we're thinking about moving forward in this area. So let me go ahead and jump in. Why do I think now is the time to do this? Well, I have definitely noticed a lot more our healthcare industry starting to pick this up, really starting last year and definitely a lot more into this year. I'll talk about a couple of use cases later in this presentation, but I think the reason why is a lot of what's on this slide is we know that there's going to be a gap in physicians by 2036, that trajectory with retirements. People have already moved out from the pandemic. And then just our pipeline of new physicians coming in, we know they're at capacity and they can't fulfill that gap. So it's just going to keep going. I actually had worked earlier this year on a workforce development effort with the Southwest PA region with West Virginia to talk about healthcare gaps and the workforce piece. And I know for a fact the universities are not able to have an increase in capacity that can really start to bridge that gap. So they're starting to think about AI to help with burnout and address that capacity issue as well. I think it's in conjunction that healthcare technology will help support some of that administrative piece and operational piece behind the scenes that can allow the physicians to focus on what they're meant to be doing, which is focusing on the patient care. There's also pressure from margins. I mean, even if you operate as a nonprofit entity, you still need to make sure that you're at least breaking even. There's a lot of payer friction out there, and making sure that we're able to meet the demands, get paid on time, and also make sure we're not compromising quality. That's a lot of things to juggle all at once. Patient expectations have also changed. Many people have smartphones now. So a lot of us are digital first, on our phones all the time, right? And then if you think about Fitbits and Apple Watches, we are monitoring our health in a way that we haven't really done before. So our patients expect that experience to be, transparent and personalized and just in time. So those could be competitive differentiators when you're thinking about leveraging AI in a way that can help our patient experience as well. At the end of the day, people do get worried about AI replacing people, but I think absolutely, I can say 100% in AI and healthcare, that is not the case. Because as I talked about the gap in that, it's really about building capacity, capability, and operational effectiveness to help bridge the gap of those that we need to have in the workforce. And then there's a lot of studies that are coming out about that and how we can leverage that technology. So there's definitely a big business case to do this right now. And like I said, I'm starting to see a shift in healthcare. I will say of all the industries, they're a little bit more of a late adopter in this, but there's certainly some first movers here that I'll highlight in a couple of slides here. We're really starting to see they're moving from just kind of playing with it or pilots or in little areas to more platform solutions that deliver that operational effectiveness. So thinking about strategically, where do we want to place the AI in a way that we can scale that to help with our clinical operations, help with our revenue cycle management and making sure we're getting paid on time, helping with our patient engagement as they're expecting that real-time engagement. And then we see EHRs, they're going AI first. So Epic is definitely one of the players and platforms out there. Oracle has a solution as well. And in those, we're seeing more ambient documentation. Talk more about that if you don't know what that is. Certainly helping from a coding perspective. So again, our accounts receivable can be assisted to get those payments, looking at fraudulent payments and different things as well. But what's really interesting for 2025 is looking at AI agents and how are we mapping together disparate processes to really look at the whole entire workflow and having our AI agents help us behind the scenes, almost like a person enhancement in some cases. I'm certainly seeing that in other industries as well. So this is the newer space for 2025 AI agents, but I think this will be a way for us to really transform our organizations by leveraging these agents. Some use cases that we're really starting to see ramp up is the ambient notes, imaging. In fact, when I was in the Chicago AI ecosystem, imaging was one of the first things, especially around radiology, that it was amazing how well it was starting to recognize those images and in fact pick up early stage tumors and different things in those areas. So that's only exponentially gotten better, especially as our servers and our data quality and our chips from like NVIDIA, for instance, are able to handle that large amount of information from an image. It's getting so much better to help enhance our radiologists and cancer oncologists. Also looking at pre-authorization automation, so we can set up agents that are tied back to our roles because we know what they are, and we can set those authorizations up to help expedite that process for our patients. And then if we're looking at investments in AI, we want to make sure that we are measuring that and understanding how this information is getting accessed. So those are all things for consideration when we're rolling it out in a larger scale. So why does it matter in healthcare? Well, we know that healthcare generates a lot of data, enormous volumes, right? From patient records to imaging, as I was just talking about. AI can process that data faster and more accurately than humans alone. We're definitely starting to see that bridge the gap. That speed allows us to diagnose patients earlier, to get better treatment options as well, and have more personalized care plans. So personalization is definitely the key, and AI can help recommend treatments that are tailored to our patients, leveraging their individual genetics, lifestyle, health history. Of course, as I would like to say, for now, human in the loop. We wouldn't just allow the AI system to recommend it directly to our patients, but I'll talk more about how that process flow happens. But it can certainly help you in doing maybe some initial research or some initial ways that we can narrow down the treatment options for our patients just based on kind of where they need to go. So what's working now? I mentioned the ambient AI for clinical notes. This is definitely an area when I was looking at use cases and the exponential uptake of the AI platforms, this is the #1 area where organizations are starting to see that. You may have experienced it yourself. It's really where the clinician or the physician or even the nurse and nurse practitioner can have this agent, this AI, listen in, capture the notes, of course, with permission with the patient, so that the clinician can have that direct conversation instead of having to type it in. I've certainly experienced that when my doctor's just really typing in, it feels like they're doing a check the box versus really having a conversation with me. So I do think it frees them up to have that direct conversation with them because the AI can capture those notes and also create some action plans or some highlights. And even if you take it a step further, we're seeing that it can generate potentially patient summaries for you. And this is definitely for those organizations that are running it out. There's some JAMA publications that are out there from Kaiser, Stanford, that are looking at 20 to 30% document time reduction in capturing this, and absolutely less after hours pajama time reported for these organizations. So there's definitely a great productivity gain. And then thinking about the quality of the physicians to hopefully reducing that burnout as well. So if we're looking at the adoption in the different areas, many of these organizations are starting with specialty clinics and expanding into the emergency doctors, emergency room. There's a lot of interesting case studies out there about that. And then I also recommend looking at clear success metrics as well. And I have a little bullet point here on what that could look like if you need a jump start. So, how many minutes are people from like once they get in the door from the emergency room all the way to release? How long is that time? What are some of those after hour minutes time, that pajama time that our physicians, clinicians are doing? What's the quality of the notes? So yes, this ambient AI can take notes, but is it of the quality that I would expect? So checking that and making sure that it's capturing it the way you want. And also we're seeing a bump in clinicians, the patient experience scores as well, because again, it's more personalized interaction, one-on-one versus your technology. So it's really interesting that is definitely an area where I'm seeing many people adopt right now. But if we look at areas of opportunity as well, in our course for AI in healthcare, we also dive deep into these areas. So I just wanted to give a quick highlight on if you were to venture into upskilling yourself, here's some areas that you could kind of explore a little bit more. And we have a lot more information. So AI is assisting clinicians in really making those complex decisions by analyzing patient data alongside latest research. Biotech pharma, I'm also seeing using AI and platforms to help expedite drug discovery. So from years, even months, to a matter of sometimes days in these being able to discover new opportunities for pharma to explore and address these issues. That is definitely accelerating that from the lab into the patient, which I think is a great thing. These applications not only improve the care, but also frees up clinicians to focus on the patient interactions as well. So if we have AI agents and kind of narrow down the opportunities, or again, do that research across to say, hey, here are some areas that could match with based on the patient protocol that you had, that can help expedite our time to get back to them. Behind the scenes, this is where I think is kind of interesting. AI is definitely starting to streamline hospital operations. So looking at optimizing scheduling, it can take a look across your organization and develop a schedule for you based on volumes and historical data. Pretty fascinating. Automating billing, again, tying it to those processes that we know for our payers in different ways, CMS and different things to get our payments. We can automate those things. It can also detect fraudulent claims. So we're definitely seeing that in the finance area. You may or may not have gotten an alert from your bank saying, hey, your credit card, did you make this payment? That's kind of the underlying technology that's allowing us to detect maybe fraudulent payments and claims. So that can eliminate some of that in our systems. And by reducing those administrative burdens, it allows, again, our healthcare professionals to spend more time on patient care. And it is helping to address some of that burnout that our physicians and clinicians are feeling. In diagnostics, this is, I think, really exciting area too. It's used in detecting conditions like cancer, stroke, even retinal disease. And it's earlier than even before. It's getting better and better and better. In those imaging pieces, the AI algorithms can actually detect subtle patterns even more recent than an experienced radiologist might miss. So that allows us to have earlier opportunity to address and intervene and have better outcomes, hopefully, right? The earlier we detect it, the earlier we can get in there and help out. And then predictive analytics, which I like to say is kind of like the unsung hero. It's not as sexy, but it is so powerful for us to kind of leverage as well. And it is falling under AI as well, but you may not have heard of it. It really leverages data. And we know, again, we have lots of data. So we can use our patient data to forecast health risks, such as like hospital readmissions, If we know somebody is prone, or if that particular person we know might have a high opportunity to come back again, we can highlight that. And identifying these risks early, our care teams can intervene proactively and prevent complications to reduce those costs at the end of the day. I'm also seeing AI chatbots that can provide patients with that 24/7 triage and guidance. So with personalized recommendations, we can help them manage chronic conditions more effectively. And these tools increase access to care, especially when we are looking at underserved areas and really like in our rural areas, empowering our patients to take a more proactive, active role in their healthcare. So I think these tools can really help enable areas that we just haven't been able to before. So let's dive into some of your colleagues that are kind of going down this path already. Thought it would be fun to kind of explore who's doing what. The first one I wanted to mention is Stanford Medicine. So they have conducted a pilot over 3 months at the end of last year, October, November, December, to test DAX Copilot. I don't know if you've heard of that, but that seems to be where a lot of platform that a lot of healthcare systems are using. DAX Copilot is an AI assistant from Microsoft. So it's a brand name that we all know and trust. And it automates clinical documentation that capture the patient encounters, generating clinical notes, and streamlining workflows. That is that ambient AI I was talking about earlier in the presentation. So this is just one of the brand name DAX Copilot. UC San Diego is also nationally recognized as an early adopter and an early mover in clinical AI. They have a couple of different areas that they're leveraging AI right now. One is for generative AI in patient messaging using Epic. That's another platform that's very known and popular out there. That Epic drafts from their AI, drafts empathetic reply to portal messages to the patients. However, the clinicians review and sign it before it's given off to the patients. So again, the human in the loop, really important. But again, it expedites the time that clinicians have to spend, and also really does a great job at capturing some of those notes that, let's face it, the patients might only remember 10 to 20% of that conversation. It really allows them to kind of review that information again when they get it home. They're also using DAX Copilot as well for ambient scribes to capture those minutes as well. And then another one that I thought was interesting, they're using Viz.ai, which is an enabling workflow to streamline stroke care and post-stroke cardiac workups to improve that patient coordination. I noticed there were a couple of healthcare systems out there that are leveraging Viz.ai. So something maybe to explore for yourself. Mayo Clinic is also sharing. Now they have, of course, they're a big healthcare system. They have lots of data. What I thought was interesting about this use case is that they're sharing de-identified data across health systems, payers, medical device companies, and academic medical centers to look at better ways to diagnose, treat, and prevent disease. So I think that's pretty cool. They're also using K-Health, another platform that includes medical chat and AI predictive models to use large data sets to help physicians optimize their diagnosing and treating while focusing on patient care. So again, it kind of helps the physician in looking at the options for that. Last but not least is Cleveland Clinic. I definitely see them. They're an early adopter in AI-enabled systems. And a few times when I go to AI conferences, I do see Cleveland Clinic folks attending as well. So they're definitely trying to beef up their knowledge. They have piloted AI documentation solutions throughout 2024. And they were evaluating different technologies and platforms across 80 specialties and subspecialties. Now they're really focusing on solutions that help alleviate the administrative burden so providers can focus again on the patients. So again, really that back end operations piece that can really use that AI piece. So lots of exciting things. That's only like a small subset of what is out there, but I thought that kind of gives you a broad scope of across the country what healthcare systems are doing in this space. But of course, with all new innovation and changes are develop some challenges here, right? So data is king. Healthcare faces some of these challenges that I have outlined here, but addressing data bias is very important. Cleaning up your data. What I like to say is, junk in, junk out. So looking at your structured and unstructured data, making sure that it is the best it can be and cleaning it up and trying to make it as bias-free as possible. You can never get to 100% unbiased because it's based on human data and we all have our own biases. But trying to make that as inclusive as possible is the key. And addressing some of those privacy issues, that's definitely from a patient perspective, you might need to address having that out there. But there are definitely ways to lock down that data so they'll feel comfortable with that. Regulatory frameworks have been evolving. They're still, of course, lagging a little bit behind the innovation and technology that's coming out there. But in my next slide, I'll be highlighting some things that have come out to help us with frameworks and roadmaps that I think are very interesting and very helpful in healthcare right now. Looking at integrating AI into our existing workflows, or even reimagining how work gets done. I think this is a great opportunity, not just to lay technology on our old organization, but to really reinvent the way that we're doing things. So this is an opportunity for us to think about things differently. Do we have to do it that way, or can we maybe streamline or reduce some waste in different areas? I think there's an opportunity here. But also our workflows with anything that we're implementing, technology, it involves people. So we have to think about that change management, the buy-in from ourselves, our employees, and building that trust across the board, because that does not happen overnight. We need to build that into our process. What I like to say is, don't let the technology lead you. It should be really business and strategy driven. What business problems are you trying to address? And then think about the technology. And of course, always involve your leaders to communicate that strategy, and also getting your teams reskilled, upskilled, so that they feel comfortable with leveraging this technology. It'll take a little bit of time, but I'll talk about that in just a minute on how do we build buy-in with our employees. So speaking of regulations, I am highlighting a couple of really, I think, targeted ones for healthcare here that will help address the safety, compliance, and trust issues. I would highly recommend checking out all of these resources. They are available online and ready for you to take a look at. If you're working with your technology teams, or if you are a technology team, I would definitely incorporate this into your project plans and your change management and impact analysis, just so you have a lot of these things covered. So first off, FDA have released just last month, August 2025, the PCCP, the Predetermined Change Control Plan. That is really providing guidance on AI-enabled devices to drive safety and effectiveness. So that was, I think, more related to around the medical devices that we might be using in our healthcare systems. They just recently hired a chief AI officer for HHS, and he's an ex-Booz Allen consultant that was working with the federal government. They have brought him in, and he is making a lot of changes and providing a lot of roadmaps for big pharma, healthcare, and also medical device teams to help them think about what are those guardrails, what is FDA looking for, when we're developing these technologies, so that we kind of know what things do we need to provide them. A lot of it is around the transparency of how the data is being used, leveraged, and stored. The next one is ONC. Not sure if you're familiar with that. I'm going to call out the acronym, which is the Office of the National Coordinator for Health Information Technology, known as ONC. Their health IT certification program, which is the HTI- and they have 1 through 7. It's a voluntary certification. It's a program that has been established by the ONC to provide certificates of health IT. If I were a purchaser of health IT, I would want to have that certification since it's been vetted. The requirements for certifications are established, the standards, implementation specification, and certification criteria by the Secretary of HHS. And if you want to learn more about that, those certifications and what it all means, you can find it at healthit.gov. So check that out. Next one down, NIST. Again, if you're not familiar with that organization, it's the National Institutes of Standards and Technology. They have just rolled out in the last 6 months an AI risk management framework, which is the RMF. It is really a wonderful framework that outlines 4 key functions to approach AI implementations through governance, mapping, measuring, and managing AI systems to improve the system's performance and trustworthiness. This is a very robust roadmap. They also have training on YouTube. If you want to do that too, you can take a look at it, and they have those roadmaps available for you to download and incorporate again into your plan. From a risk management perspective, I think it's a great way to think about any AI implementations. And then CMS also has their patient access API. So the PA API. This is a set of regulations that means that your health plan or your practice must make available all of your claims and clinical data contained in your systems via an API endpoint. If you're not familiar with API, I don't always assume everybody knows the acronyms. API, if you haven't come across, it's really just that interconnected piece. So kind of think it like a string from one system to the other. So interoperability is what we like to call it. So just kind of making a bridge between those systems so the data can flow back and forth. The API endpoint is where you can share this data to third-party applications of the patient's choosing. So think between the payer and the provider, or between 2 different payers. CMS has created, which I think would be interesting for you to know, an interoperability implementation guide and standards that can help healthcare systems adopt what they call HL7, which is the health level 7. For, again, sorry, lots of acronyms, using their fast healthcare interoperability resources, or the FHIR. All of that information can be found on cms.gov. Again, it's laid out really nicely. So if that was an acronym word salad for you, there, a couple of different resources. If you need me to name that out again, just let me know. But I think these resources are available on our a lot of the regulatory sites at this point. So this all being said, you can see that regulatory is really trying to create frameworks, roadmaps, and guidelines for us to implement these in a safe, effective, and transparent way that we can get earlier adoption. So I would definitely encourage you to align your governance structures within your organization to these frameworks to adopt it in the early phases. And then last but not least, I wanted to touch quickly on security. That is definitely one of the things I get a lot of questions on. We know we need to be HIPAA compliant. What does that look like? Here are some things that I think are really important to think when you're looking at technology. I would highly encourage using enterprise cloud solutions with BAA. BAA stands for Business Associate Agreement. And that is hosted on major providers and servers like Microsoft Azure, Google Cloud, and also AWS, which is Amazon. Um, these systems obviously are credible and people know about them. And they also have been developing AI platforms for decades, well, over a decade, maybe even decades. So they know how to secure and lock down systems. One thing in the course that we have for AI in healthcare that I think is very interesting around patient data and security is using the use of blockchain as well to encrypt our patient data. That's definitely a really interesting use case that I'm starting to see more and more to help us protect our patient information. So even if somebody, a bad actor, gets into our systems, that blockchain will be that next level of protection so that that doesn't leak out. So you want to look at, who is accessing the data as well. So what roles within your organization have it, and to what extent? Do they have administrative, or do they just have viewing? So things to think about when you're rolling out technology. Not everybody's going to have the same level of access. And of course, you're going to need to do training around data. How is it retained? How are you training the data? How are we leveraging the data? And also, I would highly encourage having that human in the loop. What are those checks? How do we support audit trails so our vendors that have this BAA actually can help us be more transparent? So when we're working with, let's say, FDA, we can show them exactly how that data is flowing through our systems. So there is not a black box. So something, again, to think about. If it's a black box proprietary piece that nobody knows how that's happening, well, that's going to be really hard to prove to the FDA, what's happening with that data. So again, security considerations, huge, really, really top of mind, especially with a lot of those bad actors that are out there just really trying to get to that data. And you can also develop prompt libraries as well. So thinking about what are the most commonly used prompts that we want us to use within our contained system. And one thing that you may not have come across is red teaming. We talk a lot about this in more kind of IT project management. So red teaming, and especially in large language models, is about kind of trying to break that system, trying to be the bad actor yourself, so that we can build those guardrails around. So when that trigger happens, it knows to go back to the safe place or not go down that rabbit hole. There's a couple of case studies out there right now about teens and suicide and how ChatGPT enabled that. So those are the things that we're trying to avoid and not go down. So red teaming is really important when you're lifting up a system and making sure that we try to poke at it as much as possible before we release it to the larger system. Okay, but I just also wanted to point out, because of healthcare, there are no consumer large language model tools for PHI. So make sure that you're going with these enterprise solutions that are backed on these data servers that are tried and true. So that would be my recommendation. You want to make sure it's secure from the beginning. Okay, and last but not least, thinking about how can I move forward here? I just gave you a ton of information. So if you're thinking about your AI adoption in your organization, the thing I really like to encourage people that I work with is understand your organizational goals or your why. Why are you doing this? What problems are you trying to address? What kind of business goals do you have with this and implementing these solutions? And really understand that before you ever pick a technology. If you're leading with the technology, then that's going to drive what you can do. I think you need to understand your business. What are you trying to address? And what are those really problem areas? And then find the solution. That's where you can start with small, the pilots, with a low risk area. Again, you want to build that organizational muscle around how to leverage AI what happens with the data and technology. Find your AI champions is what I like to say in your organization. There are people that are really hungry to learn more about this and think, yeah, this is a great career move for me to learn more about this because I still have 20 years in my career. Why don't I dive into that? So understand who your champions are, who are advocating for AI, and help them embed them in these implementations. Also looking at how can we help drive adoption and share those success stories. Part of it too is just that reskilling and upskilling opportunity. When you look at your impact analysis of what processes are going to be touched, what roles will be impacted, who's going to be interfacing with these technologies, that's the area for upskilling on, how do we use these tools? What does that look like? What does that training look like? And obviously the Upskilling Academy and AI certs can help fill those gaps so you don't have to necessarily, build that in-house, leverage the experts that are out there. So that's my last plug for that. If you have any questions, I am here to answer that for you now.
Tiffany, my goodness, that
My
was captivating.
good.
As somebody who has been to the doctors and had his charts mixed up with a different Lee Phillips, I definitely see the value of adding AI and automation within the healthcare industry.
Yes.
That being said, we have a bunch of questions in the chat
Great.
from an anonymous attendee, shrouded in mystery here. Do you foresee that AI will replace many roles that are under admin and operations, such as positions that work directly just in billing, etc.? Could AI potentially replace those roles or completely or reduce the human roles for this? And they added a note that they are making a big career transition post-Navy corpsman, medic of 33 years, acting chief in DC area.
Got it. Yeah. Hot topic. If I had a crystal ball, I don't know. Here's my gut. I think certain roles will definitely be going away. But with any new technology, as we've seen that roll out, new roles will be created. So by you being here today and just starting to learn about AI, positioning yourself, getting those certifications, you put yourself in a better position for your career. I truly, truly believe that. I'm seeing more job postings that want those AI certifications. So that's, I think, as a professional development opportunity, we're going to continually learn, grow, and build those skill sets. So I think, if I'm being honest, like, yes, some of those hours, so let's take billing. Some of those roles, we won't need as many people. However, I always caution organizations that are using it as a reduction in force activity. It's more about enhancing and giving your employees superpowers so they can do things better and faster by enhancing these tools. I think if you look at healthcare too, there's a huge gap in people that can fill those roles too. So I think it's just going to be an enhancer to help with the volume of things that are happening, not only in the front end, but in the back end of our businesses.
Great answer, and I think it goes to the testament of the mission statement of AI Search that, the fear of replacing jobs within the AI, it shouldn't necessarily be as big as it is, but rather how do you harness the power of AI to further your career within these changing times?
Yeah.
Um, Tyler asked a question of my wife being a nurse in a hospital. First of all, round of
Yes.
applause for Tyler's wife. How can AI and EHR improve her day to day? What are some key things that a nurse on the floor would notice?
Mm. I mean, I'm thinking that they would be able to digest information and access information that the clinicians and physicians are having. So they are kind of on the same page here. So I definitely have used a tool called Otter. I can't do that in healthcare, but it captures meeting notes real time for me. So again, that's where I'm seeing a huge uptick, and I'm not having to capture notes and write it down where I'm missing part of the conversation. It's captured for me, and it has action items, and it has summaries of this is what we talked about. So I think that can enhance nurses to be able to enable the care and know exactly where do they need to focus on for their patients.
As somebody who uses an AI note scriber myself, it looks way better than my handwriting. I'll tell you that.
Uh, yeah.
Colin asks, what certs or security is needed from the three MyCC tracks to interview for a job? He mentions I have no practical IT or AI records yet. So is there anything beyond the AI plus healthcare course that Upskill Academy offers?
I think that's a Bill question. I'll have him come off mute.
We'll see if Bill's paying attention. There he is.
Bill is always paying
There
attention.
he is.
Hey, Bill.
So,
Well,
Bill,
the
just to
question
recap,
was, yeah, go
the
ahead.
question was, what certs or security is needed from the three MyCC tracks to interview for a job? Colin mentions he has no practical IT or AI records yet.
I think, I mean, it's less of a particular course that when you don't have relevant experience that put together a small project that you can show that you know the concepts of the work that you're going to be asked for.
I like that.
I,
I'll build on that with Bill. Having the practical experience of trying these things out is the best thing that you can do. So if you have opportunities to work maybe with smaller business, like I think there's a great, I mean, they don't have a lot of money, but they know they need to do something that can give you some experience in testing that out and know, oops, that didn't work or that worked really well. And then that builds your portfolio.
And nonprofits would definitely looking for help on this
There
too.
you go.
So
I think that's the two great areas that are dying for help.
nice, great answers.
Mm.
And last question I have here, also from Tyler. He says, second question for me at the end. You mentioned these large hospital networks with large data sets and resources and budgets leveraging AI. How would a small hospital be able to implement and keep up technology like this? Would they rely on the vendor like Epic?
Yeah. Yeah. I think Epic is probably a good solution because they have built an enormous data set out there that you can access. And I think when I was looking at their pricing point, it's actually not too bad. You might be able to go out there and negotiate with them too, as well as they're trying to build their clientele, but they're certainly a player that I have seen out there. And you know what? Reach out to your colleagues in Cleveland Clinic and Mayo, and they might have some ways to like point you to some lower cost solutions or partners that they, would recommend. So leverage your network.
Always good advice there. And I lied. I had one more question sneak in. Ryan got one in right at the end here. As someone who is interested in moving into IT and healthcare as a profession, what key skills or programs are needed? I'm rewording his question a little bit. What skills or programs are key to focus in on getting involved?
Um,
That's an open-ended question for
that's an
sure.
open-ended question. Without knowing your background, it's really hard to say. Ryan, do you have a IT background? I guess is like my first question. Are you pivoting into healthcare? Maybe he can type that in there.
Let's see. He said somewhat mostly freelance.
Okay. All right. I mean, I think, and I keep an eye out on job postings just from AI because it does kind of tell me where things are going. So from a healthcare perspective, um, a lot of these technologies are fairly new, like in the last 3 or so years, especially with generative AI and incorporating that. We're seeing an exponential curve. So getting that practical experience, again, what Bill had talked about is getting that practical experience across the board, even just having that implementation, understanding to that slide I did for the rules of the road, the FDA, the ONC, knowing those acronyms and what are the frameworks out there specifically for healthcare as well. Get yourself immersed in those entities and also kind of what's out there from a bigger player of vendors could help you get a foot in the door.
I'd like to add real quick too that the beauty of the internet to study case studies, that you can find case studies, YouTube videos of case studies and immerse yourself in all that. And then, if only there were some courses that would, be specific for healthcare case studies and healthcare AI job role tools. I think
Correct.
What
I
a
think Lee knows somebody.
what what a wonderful segue, Bill. That was wonderful. You should come onto the
I wrapped
marketing
it up
side
in
of
a
things
bow.
here. So I will end today's presentation by sharing this one final slide here. First of all, thank you all for attending today. If you'd like, these 3 QR codes you see here. First one is to just visit the Upskill Academy website, where you can see all of the AI Certs courses, including AI plus healthcare, which is what Bill was just referencing. If you'd like to schedule some time to chat with us, we are more than happy to take some phone calls. We can connect you with an upskill professional that can kind of go through your personal needs and decide, what we can do to help you guys out. That is that second QR code. And if you just have a random question, just feel like dropping us a line. We have a contact us form on that third QR code. And as promised with this webinar, first of all, just a quick housekeeping note, everything here is recorded. We will send this presentation out to everyone who registered in a follow-up email within the next 24 hours. Thank you all for your questions and chat. And last but certainly not least, as promised, we are giving away 3 free e-learning seats to our AI Plus Healthcare course. This is very cool. It's we ballpark it around a 6-hour training session that you can do at your own pace, at your own time. Those winners will be announced in our follow-up email as well. So we're going to take everybody who attended today, which thank you all so much again. We're going to put them into a random wheel and spin it out, and we're going to get 3 lucky winners to get a free e-learning seat for our AI Plus Healthcare course. Did I miss anything, guys? Any final words?
Oh, I think you tied it up great.
Awesome. Well, thank you, Bill, and super thank you to you, Tiffany. Just a wealth of knowledge. We were lucky to have you here today. Thank you for everyone who attended today, and we will see you guys on our next webinar.
Sounds great. Have a good day.
Thanks.
Thanks, everybody.